I live, whole areas described as dental deserts because there's simply nobody taking on any new patients at all. Joining me now is Mani Bhardwaj, the dental expert and founder of the Smile Studios. Good afternoon.
Good afternoon, Livy. How are you?
This has been an ongoing problem for a long time now, hasn't it? Why is it, just in a line, why has it become such a problem? Is it because of the NHS contract system, with how the government pays for dentistry, or is there an actual shortage of actual dentists?
It's a multifactorial factor, actually, because you've touched on two topics which are definitely true. Firstly, there's the patient side of it where, patients are finding it hard because there is a reduction of NHS workflow. The dentists have simply left the NHS system, whether that was a continuation from COVID or after that, and then on top of that, the payment system has... It's been 15 years that the government's been told it needs to reform, and still we have seen no reform. So it's failing, simply put.
I have heard it described as a system which only works if you have an area of a pretty healthy and affluent population not needing much care, and that it falls to pieces because the work is too hard and grueling and underpaid if there's a lot of dental problem in a community. Is that fair enough?
Kind of, yes. We work on a unit of dental activity, which is abbreviated UDA. The problem is in affluent areas, generally the most of the population do not require much dental needs, so therefore come in for a checkup and simply, not needing much dental treatment. In poor areas, we're seeing higher needs, so the dentists are expected to perform multiple, if not exceedingly amount of fillings or treatment under one band, which they simply are not being paid enough for, and therefore they're being disincentivized to not work on the NHS.
So there's an intensive pressure on dentists, I would imagine.
Absolutely.
If somebody comes in with really rotten teeth, which haven't been well looked after because of poverty, because of other kind of deprivation, or just because of not having ever seen a dentist before, then they've got an enormous amount of work for the same money as they would have got for just doing a routine little job on somebody who's healthy.
Absolutely, yes. It's a massive ethical dilemma. We've taken Hippocratic oath to look after our patients, but at the same time, when financially we just can't make it viable, that puts dentists in a very tricky line. And rather than being struck off for not providing efficient or ethical care, the dentist simply walks away from the NHS or provides private. And as you said, before, some people can afford it and some cannot.
What is safe for people to try and do themselves? And we have seen horrific news footage in my area, in the east of England, of people actually pulling their own teeth out. What can people do for themselves?
Strictly put, I personally wouldn't touch any sort of DIY dentistry, or would not advocate any person do it themselves, because many people have medical complications they may or know about or don't know about, and simply taking your own tooth out could lead to excessive bleeding or uncontrolled bleeding. I would always go to a professional. I mean, it's simply put, I don't try plumbing myself. I'm not a plumber. I wouldn't advise anyone to try dentistry themselves.
Is the pressure on dentists as workers something we should be worrying about?
Absolutely. It was a factor. I was discussing this only last night with some friends, that dentists have the highest suicide rate in one of the professions. We are under extreme pressure in terms of work for, and in terms of how many days or how many patients we need to see. And then on top of that, if you add the financial dilemma and the ethical/financial dilemma, it puts us in a very, very tricky situation. We all want to, and I speak for the whole dentistry, we all want to treat our patients with the utmost care and make sure their oral health is sustained. However, with certain factors that are abiding us to this type of work, we simply cannot do it.
And I think people in A&E departments would be very glad to have better dentistry, because apparently an enormous amount of people do just simply go to A&E now when things get really bad.
Yeah, and it's clogging up the waiting time there, and those patients are being told to go back to see the dentist, and then it's a catch-22 because they don't have a dentist.
Dr. Mani Bhardwaj, thank you very much for that brief and depressing account. Again, dentistry is something very much on government's to-do list. Another medical question is about ketamine. You may know about ketamine as an illegal party